All right. Hello, everyone. If all of our panelists want to come on video, that would be great. And then we're going to get started. Just as an FYI, we are already live. We're already streaming on YouTube so that you know that. I do have somebody on the Hope for the Day account and also somebody, well, you can see Kira because her name is on the screen. But there will be folks in the chat moderating and checking stuff out for us. So don't worry about that. But yeah, let's get started. So a couple housekeeping rules that I want to mention is that today is basically going to go, I'm going to introduce the panel, and then you guys can turn your cameras on and off as you feel necessary, but we will be the only four faces folks get to see tonight. I also want to mention too that if anybody in the audience, either on YouTube or in Zoom, is able to submit questions through whatever technology experience you are currently having. I know it's a little bit different on both platforms. At 6:40, so in 40 minutes, if you're in a different time zone, that will be available. We do have some preset questions, and we're going to go through those, but at the end, at around 6:40, you will be able to ask questions as well. And at 6:55, if you want to know who all these wonderful people are and get more information about all the amazing work that they do, they'll be dropping the information they want to add in the chat as well. So all of that will be there in the future, but for now, let's get started. So I want to say that welcome everyone. Thank you so much for being here. As you can see on the screen, we have some wonderful panelists that we're going to introduce tonight. And I'm really excited to learn a little bit more about therapy and all the things that go along with it. And we're going to dive in. So who am I? What am I doing here? I'm Allison Herman. I'm the Director of Education here at Hope for the Day. And Hope for the Day, if you don't know us, is a nonprofit movement founded in 2011, focusing on empowering the conversation on proactive suicide prevention and mental health education. And we strive to eliminate the highest risk factors for suicide by normalizing the conversation regarding mental health and providing education and resources to support individuals and their communities throughout their journey. And I'm going to introduce our panelists. So first up, we have Salimah. Salimah is a Black therapist and licensed clinical social worker specializing in individual, family, and group therapy. Salimah is skilled in working with adolescents, adults, and families, and has provided therapy in a variety of settings, including private practice, in-home, hospital, inpatient, outpatient, collegiate, and various community environments. Her areas of specialty include maternal mental health, depression, LGBT concerns, and she's also able to assist with breast/chest feeding and lactation concerns as well. So thank you so much for being here. I really appreciate it. Next, we have Abby. Abby is a second-year doctoral student in the clinical psychology department at Adler University. Having worked in student affairs, residence life, student interactions, parent interactions, she's very experienced with many scenarios, including students facing depression, anxiety, grief, trauma, substance use, and sexual assault. Additionally, she's worked with parents and explored the impact of biculturalism within a family and how that really impacts a child's self-identity. Abby is also dedicated to helping people find their sense of worth and belonging as individuals and those around them. As a first-generation Latina from the South Side of Chicago, Abby has seen the difficulties and challenges of feeling unwanted and not good enough. Whether it's talking about yourself, a relationship, challenges, or struggles, Abby's here to walk you through all of that. And additionally, she provides therapy in English and Spanish as a bilingual therapist. Thank you so much for being here. And lastly, we have Cassie. Cassie is a Black queer social worker, trauma therapist, writer, gamer, and activist. They are the owner of their practice, Intersection Center for Complex Healing, a clinical program manager for Take This, and a member of Hope for the Day's Clinical Oversight Committee. They are also an amazing healer and a certified clinical trauma professional, a certified NARM therapist, a certified hypnotherapy, and NLP. I don't know what that last one is, but all very impressive. And Cassie presents a diverse array of intersections, topics related to race, gender, sexuality, relationships, gaming, mental wellness, trauma, workplace culture, social justice, and they provide therapy to adults, relationships, and groups. Again, thank you so much to everyone for being here. We have a great selection of panelists. I'm really excited to get started. So let's ask some questions and go through it. The first question I'm going to ask is a pretty basic one, but I want to know, what does mental health mean to each one of you when we think about this topic and kind of getting introduced into this panel?
Okay, well, I'll go ahead and get this started. So very excited to be here. Hi, everyone. Hi, everyone else out there in the universe. I hope this is what you need to be and that you get a lot out of it. But yes, that question, what is mental health? So we know the dictionary definition. It's our emotional, it's our psychological, it's our social well-being. So I think we've kind of settled on that piece. But for me, I like to say that mental health it's health, period. Take that first word off, it's health. And what we know about our mental health is that it impacts how we view ourselves, how we view the world, how we interact with the world and the people in it. And if we have some challenges in that area, it can definitely impact our overall health. So for me, bottom line, mental health is health. And I like to put it on the same platform that we put every other thing that we have going on in terms of our being. Mental health is a part of us. Mental health is health, period.
Thank you.
I think going off of that too, for me, it's all about self-care. And that's something that this year, my goal is to embrace self-care, taking yourself out of what you're doing. So like if it's a busy life of work, school, or if you got a lot of stuff going on, take a moment to just reflect on yourself. You know, for me, it's doing some like facial masks or going on a run or do something that I'm really passionate about. And just in the moment, being able to be in your own little bubble of like, what do you enjoy? What is something that makes you happy and makes you really joyful?
Yeah, and to build off of what Abby and Salimah have already said, making sure that we include the communal, right? As far as when we talk about health and specifically the segment of mental health and wellness, the fact that, we are a social species, like humans need each other, we're a part of societies. And so mental health is not able to be removed from our environment, from community or lack thereof. Community care is a vital part because a lot of times we do focus, especially in westernized mental health context, we focus too much on the individual to the exclusion of the whole self and including community.
Yeah, absolutely. Thank you. And I really want to dive into it. So what is therapy and what isn't? And this is basically a misconceptions, misunderstanding question. Whoever wants to go first, I see a lot of smiling. I'm excited.
Yeah, I'll go. I forgot to unmute, or I forgot to mute, so we'll go. Let's go. I'll start off with therapy is not advice. It's not a friend or what have you, right? Like people are like, oh yeah, I'll go to therapy and I'll get advice, and it's like actually like a lot of therapy is reflecting and helping you to connect with yourself so that you can trust yourself and trust your own and build up your own intuition and knowledge and skills. It's not someone telling you what to do, because that would just be a replication of the traumas and environmental factors that likely got you here in the first place. So I'll start there and then let someone else take another one, round robin style.
I love it. And yes, I was on mute, but it's like, yes, I agree. I concur. And I saw some other head nods. So I think we're all on the same page with that. Absolutely. And that is one thing that I do stress with my clients is, I don't give advice. And I give that like up front, because essentially it would be me putting my values onto you as the client. And that's not fair. That's not fair at all. to kind of piggyback, I also like to stress like therapy equates to like a licensed mental health professional. I always like to put that out there too, because there is education and there is training that is needed to be able to hold space and support the clients and the things that they bring into our space. So I like to stress that. I'm very good at giving analogies, and I like to use, like, my kitchen, my bathroom. If I got a plumbing issue in the kitchen or the bathroom, I'm going to call the plumber, because the plumber has had the training. The plumber has the expertise to be able to help whatever this is that I think is something going on. Something's stopped up, something's not working. I don't know, got on YouTube. I think I kind of figured it out, but that plumber is going to be the person that is trained and equipped to be able to do that. I love the electricians. They're phenomenal, but I'm not going to call my electrician to help me with the plumbing issues that are taking place with my toilet or my sink. So I love to kind of use that analogy, but it's something to be said about working with a licensed professional that's equipped to handle whatever it is that you're bringing. That is so important. So important.
And I know for me, I love to emphasize this fact because I think it also coordinates with my life when I was younger, that I was told this, no longer anymore. It's no longer a thing, but therapy is not just for quote unquote, how my culture says it, crazy people. It is not just for crazy people. It's for everyone. Even if it's just a moment where you need to acknowledge patterns that you're noticing is affecting your life, let's talk about it. Let's sit and focus on it. And you don't have to be, like I emphasize, you don't have to be crazy or saying like, I am just going through so much, I need to talk to someone. It can even be for like a simple, like, I need support, how to organize my day. Let's talk about that. And I like the analogies because I use that too with my clients. One of the things I like to say is, there's an analogy where I say about driving, like my client is the driver. You're the one driving the car. You're the one who's handling, the direction that you want to do this therapy session with. And I'm the one in the passenger seat, just being there as like that support, that acknowledging what are the patterns that we're noticing? What are the resources that I can provide you? And I'm not, like you mentioned, it's not advice giving of like, you're going to turn in this lane and now you're going to do this. It's because for that, it's like, I'm putting my own feelings and my own ideas into the client. And that is not the intention for that.
I would also say therapy is not the end all be all for mental health and wellness and healing. There are a lot of components to what helps us be and stay well. And therapy can be helpful. It's not necessarily everything, and it's not going to be able to give you everything. It is a stepping point, just like with anything, right? It's part of a scaffolding. And the hope is that you will not need us forever, right? I do long-term therapy. And so like I'll see people for 5 years or more, right? Working on long-term complex trauma healing. But my goal is always the same, and that is to work myself out of a job consistently with every single person I see so that they feel that they have the community, the skills, the other forms of coping and wellness and dealing, that they don't necessarily need this form all the time, every week, multiple times a week.
Awesome. Thank you. I think that's great examples, great definitions. We're going to switch gears a little bit and talk about what everybody's always talking about, which is social media. So I want to talk about, in your opinion, my question is, how does social media play a role in engagement and conversations you're having in therapy, either as a therapist or with your clients? How is that kind of showing up in your practices?
For me, I would say, it's huge. Social media has impacted like every facet of our lives. It's here. I don't think it's going anywhere anytime soon. But oftentimes social media, at least in my experience, has been the catalyst to what has gotten some of my clients to my office. It's what prompted them to make the phone call. It's what prompted them to ask a question like, is this a thing? Or, I was on insert whatever social media platform and I read this. Oh my goodness, could this be me? So it's a lot of it has prompted them to come to therapy and just figure out what this thing is all about. In terms of like a marketing standpoint, it's the go-to social media, that's where the people are. So, so we're in those spaces. I always use the example. I recall listening to one of my stations on Sirius XM, and there was a person that was on there that was talking about their experience. They were a guest on a particular show, and I heard the story, and I said, "Hey, wait a minute! I can offer some resources here. That's one of my specialties." And so I utilized a social media platform and reached out to the host of the show to say, "Hey, get me in contact with that person and their legal team because I have something to offer." So we were able to link up, and I was able to provide that person with a service. I was able to be of assistance. So social media definitely played a role in making that connection. Without it, I don't think I would have been able to assist that person. So it's been a good thing for sure.
I know for me, I've noticed a pattern with clients that so far I've had a couple intakes where they've been like, social media has been the reason why I'm here. It's the same thing. They're like, I've noticed them bringing up on TikTok. There's some TikToks where they'll be like, these are symptoms of ADHD, or these are some symptoms of generalized anxiety disorder. You have this, you have that. And then they'll be like, I literally think I have that. And so it's a great way for them to come in and be like, there is someone that maybe is the same that I am. I'm going through the same things. Maybe I have the same symptoms. I want to be able to talk about them, seek support, and seek help with that.
Yeah, I guess I'm gonna be the one to rain on the parade a little bit of social media is a double-edged sword, right? So I see it as a tool that brings people in, right? And opens the door to say, oh, other people are getting therapy. I can get therapy. I have some idea of what therapy is, what kind of therapy I may be interested in, what kind of therapy maybe I want to stay away from. And I also do a lot of work with people on managing their social media consumption and doom scrolling and revenge insomnia and these things that have names, don't have names, but we've all done, where it's impacting your sleep and perhaps it's jeopardizing your career and your job. I do a lot in mental health and gaming as well. And so people getting doxxed and swatted because their information gets put in on social media or, hate groups and harassment. And so it's been a very powerful tool of destigmatization in a lot of ways for mental health. And it's also been a really difficult tool for people to manage in order to protect their mental health, because it's also increased access to people, which increases entitlement, right? And so being able to set those boundaries, block people without feeling guilty, mute people without feeling like it's a betrayal or whatever, so that folks aren't subjecting themselves to things, learning the platforms so that you don't have videos of people being murdered auto playing on your feed without any ability to moderate that. And so it's definitely been a double-edged sword from what I've seen in my own life and in my practice.
Indeed, definitely two sides to the social media component. Indeed.
Awesome, thank you. Because yeah, my next question was going to be hey, how has mental health changed? I know some of you have practiced longer than others, but how has mental health changed as social media has increased? And how do you expect it to continue to change with some of these new things popping in? When we go into schools, it is always the conversation we have where maybe the therapists on social media aren't your therapists. So how do we figure out how to filter some of those things, and what changes have you seen in the field in general because of social media?
It's it's a challenge, because with social media, the growth of social media, if we go back to the height of COVID, when COVID kind of began, we were in this space where like technology was like the only connection for an extended period of time that we had with people. And so whoa and wow, that's about all I have for that. But social media like really picked up during the pandemic. And we're still in that space now where if you have access to Wi-Fi, an electronic device of some sort, and a social media account, you have a platform. Everyone, you have a platform if you have those, those things under your belt. And so it puts us in this space to where everyone has a platform, and there's a lot of information that's out there that is not healthy, that is inaccurate, that is false, unhealthy. There's a lot of stuff floating around out there. And we do have, some people out there that, may not have the tools to be able to decipher what's accurate, what's healthy, what's true. And we run into issues, when we are in that space, because any and everyone, can have a platform. On the flip side, we're in this space that says like mental health and that the negative stigma has been shattered. So this is good, because now we're talking about this. We've got hashtags and we're having conversations and we're having dialogues. But like we talked about, there's two sides to that. Where is it headed? Oh my goodness, the sky is the limit. I think we're in that space now where mental health is big business. We see tech companies that have emerged. They shall remain nameless, but a lot of tech companies have emerged, and they are providing mental health services. So we've seen a lot of that. But I think mental health is big business. And, these platforms have, jumped on the band. I'm not sure if it's good or bad, but this is where we are. And I don't see that coming to a pause in the near future.
Oh, I'll name names.
I don't want to give them any. I don't want to give them any clout.
Oh, it's not clout. They're not gonna like what I'm about to say. So with that, right? Like when we talk about not just social media, but technology and mental health and how it's changed, right? We are now in an age where we are seeing that we've got proof positive. This is big business. We can make money here, which means that now we really have to be careful, because we've got some really bad actors coming into the space who are exploiting both people seeking services and people providing services in a mass variety of way. Everything from overstating what their products can do, and how they've been created, to low pay, high caseloads and selling client and therapist data without permission. And so those kinds of front runners that we've seen are now kind of crumbling in ways that are harming people, both because their data has been sold and because they can't get prescriptions from the places they've been getting prescriptions, because now that's also being cracked down on, because our lawmakers don't know what they're talking about and are very woefully behind on these issues. And it is resulting in a lot of mess that is very harmful for everyone involved. And so we're seeing people getting diagnosed, misdiagnosed, treated, mistreated, with not a lot of recourse. And so we've seen this kind of double-edged sword of more people trying to get into therapy, deficits in supply because of other issues that could be a whole nother panel, as far as how we do get trained licensed professionals. And so when we look at things like looking into AI for providing treatment, bad idea. There's a game called Eliza. It's a fabulous game, terrifying because of how close to like present it is, but it's a great game, and it teaches you the lesson that like it's a bad idea. Go play Eliza. And so I think that we're gonna kind of, the next 5 years are going to be a lot more of this trial era, regulation, deregulation, back and forth as people figure things out. And as we also, because of social media, and tech and broader access to tech, we are also questioning these therapies that were not designed and not researched on people like us who are on this panel. And so we are questioning these things that blame the individual without looking at the systemic. These therapies that are kind of manualized out of the box, considered evidence-based, but then you look at who the evidence is for and it's not what it's sold to be. And so I think we're going to continue having both greater access and also more reckonings.
Yeah, and I feel, Cassie, you pretty much said everything. I was like, yes, yes, yes. And then another thing I thought about too, it's that social media, sometimes it always has that comparison for an individual. Sometimes there's always that, I think it was also mentioned that there's that comparison with someone like, oh, so-and-so has a perfect life. Like, look at them on Instagram, going on a yacht, going on vacation, but we don't know, like, are they really happy at that vacation? Are they really happy on the yacht? Are they really happy on the cruise? It's always important to like also think of the idea of perfectionism, like maybe at specific age. And I think this also goes with my cohort too. At like our age, everyone that we know is getting married. They're following the getting married, having kids, getting engaged. And all of us were like, we're at this age and we have none of that. And it's always that comparison of like, so-and-so has a great life. And here I am, I'm nowhere near where I want to be. And where social media is going, I feel like it can go either or. It's like Cassie said, it's a trial and error. And we have talked about this in some of my courses, where there's some therapy sites that I will not name. I would rather not name it all, but that they'll be like, you get free therapy, like sign up now. And you sign up. And I know one of my classmates they're like, I signed up and they were like, JK, you owe us $230 before you started your session with us. And we're just like, wow, that's some free session. So it's always like a trial and error. I do hope that one day, it's accessible to everyone, but we'll see what happens.
And I am going to name names because I think people deserve to know. This is supposed to be informational. And I think if the buyer's supposed to beware, you should know what to beware of. So we're talking about BetterHelp Talkspace. Yes. And who was the prescriber that just got by the government? Does anyone remember their name? I can't remember their name. I'll come up with it later. But those are the two main companies that we're talking about who are doing these things, and you deserve to know so that you can actually know what you're signing up for, because there's a lot of bait and switch happening. There's a lot of providers' information being used on their directories, and those providers are not affiliated. They're data scraping what is the national provider numbers, NPIs. They're data scraping those, and they're putting our information without our consent on their directories to trick you into thinking we work with them. And they sell your data to third parties, and they're now being investigated by the government in various ways. Those are the two bad actors that are currently under federal investigation for poor practices on multiple facets.
So buyer beware. This is you gotta read the fine print. There's so many layers. Some of the stuff isn't even in the fine print. So buyer beware. We're talking health, we're talking your wellness. That's important. Buyer beware when looking at these platforms.
And with that, I will say, like, when we're talking about social media and things, so since we're already on it, I'm going to go ahead and say, like, a therapist who provides services via telehealth is not the same as a telehealth tech company, which is what those companies are. I own my own practice. I am in this room. This is the therapy view, right? I use a privacy compliant software, HIPAA compliant software, and I do therapy with people like this, right? You can get therapy that way without using those platforms. And it's just about finding who's reputable, like where the directories are, paying attention to what's sponsored content and sponsored search results on Google.
Yeah, thank you. I appreciate all of that. And I think it's really helpful to help people navigate those systems because, yeah, that's a conversation my therapist and I had when we went to telehealth in 2020. Like, hey, this is a protected platform. It's like you're sitting in my office. It is not through Zoom. Like, we're making sure that it's a safe place to do that. So I really appreciate that. And kind of coming off of resources, what are some resources where young people wanting to pursue therapy can go? We often get a lot of questions about people don't have health insurance. Maybe they're younger than 18. Maybe they're a little nervous that their family isn't quite on board yet. How can they find the resources they need to start having those conversations and pursuing therapy, given all the information we have today as well?
I am a proponent of, starting where you are. If you are a middle school student, a high school student, start there. Start with your school counselor. You very well could start there. The school environment, it's already a familiar space, and your school counselor should be able to help you to navigate that space and to sort it out and to figure out if you are unable to get therapeutic services at school, what that could look like on the outside. There are some, some states that will allow like minors, as young as 12 to get mental health care, just a limited number of sessions. Maybe that might be of value, but the school counselor, could be a point of reference to start with. If you are a college student, perhaps, on a college campus, you very well could start with the counseling center on your college campus to receive counseling services. College counseling services, they are limited, some of them, in that they may be on a brief model, or they may have up to 10 or 12 sessions, and maybe a student is needing more than that, but that could be a place to start. They oftentimes do have wait lists, but that's a place to start, and you very well could get referrals elsewhere to get the treatment that you need. But start where you are. The schools, if there's a GSA, Gay Straight Alliance, that's a resource. Start there to ask about resources in the area, but just start where you are. School, college campus, start there.
Yeah, also, so if those places don't feel safe, because we've all read the news, because we've all been on social media, you can use an incognito window, go to the library and search. There are, depending on where you are, is going to inform what's around, but you can look for identity specific directories, things like Therapy for Black Girls, or the National Queer Trans Therapists of Color Network, and Loveland Foundation, and Taraji P. Henson. I'm listing a lot of things that are predominantly people of color and Black folks, because that is my specialty. That's who I work with, and also queer. So, but regardless, like in Chicago, we've got places like Sister Afia and Coffee, Hip Hop, and Mental Health that has a therapy fund and a directory of their own. And so you can use those resources as well, because all of the ones I just listed, with the exception of Sista Afia, who does things a little differently, but has mental health funds that help you pay for it. So if you don't have insurance and you need help paying for it, the therapists in those networks take those vouchers. Places like Sista Afia, and I'm listing Chicago specific because that's where I'm at, but Sista Afia or Synaron Halstead or Howard Brown have free options, right? And so those are also possibilities. What is becoming, well, has been popular recently is public libraries having social workers on staff that can help you connect to resources. And so also being able to do that and go to walk-in centers and things like that can also help you to find what you're looking for.
Going off with that too, you know, I've always recommended those two options. If an individual doesn't feel safe in a school, you know, those are great options too. And I know for me, I work with a lot of identifying female clients, specifically Latinas. There is a great resource in the South Side called it's called The Circle, and it helps a lot of women who, you know, have faced trauma, have faced abuse, or are coming from Mexico or anywhere that identifies with the Latinx culture, that are free resources, you know. And the struggle that I always emphasize with that is that it always has long wait lists, which till this day I'm really frustrated and really annoyed with the reason of wait lists and having to wait for a free resource, when I still believe till this day that mental health should be free for everyone.
Yeah, absolutely. And thank you, Abby. You actually keyed me into the next question, so we're good to go. Do you have any insight on how to challenge cultural stigma specifically when seeking help? Hope for the Day talks a lot about general stigma, but I think cultural stigma is huge, especially for a lot of the young folks that I work with. And what's the best way that they can start to challenge that so that they can get into these experiences?
Well, some of this is, first of all, I would just say, you know, hats off, just the state that we're in now, like mental health is being talked about more and more and more. I'm seeing like church congregations, you know, speaking about mental health, providing resources. It's like, wow, you know, whoa, like when did that happen? Amazing. So there, you know, there's some good work being done out there. Talking about this stuff. I think starting there and, you know, just in having conversations, you know, within our circles, you know, sometimes it may be a challenge, you know, as a younger person to have these conversations with, you know, with the elders, with the adults, and depending on, you know, the situation, you know, maybe it might not be safe, but perhaps within that friend group, having a conversation about mental health. We talk about everything else. It's, you know, add that to the list. It's if you're in therapy, if you feel comfortable, you know, sharing that within your circle to let your circle know that, hey, you know, this is something that I'm doing, you know, it's a cool thing. And, you know, let me tell you, I'll tell you about my therapist. It's perhaps, you know, making a recommendation, you know, to a friend to say, hey, you know what, you know, why don't you, you know, would you consider giving this a try? You know, I think this, you know, could be something good for you, but it's having those conversations, you know, within the peer group. I think that with the younger population, it's something, it feels different. It's something about getting this information, you know, from someone, you know, within your peer group. It does something. It feels better. It resonates better. It hits differently. So that could be a good place to start, having those conversations within the circle.
I know I always bring up the idea of validating yourself and validating what you believe in. You know, when you're talking about that, like, for example, what was just mentioned with, you know, talking in your circle, talking with friends, validating what you believe in. And if you believe, you know, mental health and seeking therapy is a great resource and it's really helpful, validate that, be proud of that. And I always say, you know, it's never wrong and it's not bad and it's not a sign of weakness, it's a sign of strength. I always emphasize that when you seek mental health and you validate what you're going through or validate, the importance of it, it's a sign of strength that you're showing yourself that, because you're seeking mental health, it's not something that you should be ashamed of. It's something that you should be proud of.
I also think just education's so powerful. And I do a lot of liberatory and decolonial work. And so from, that stance, where does the stigma come from? Because it's not us. It didn't start with us. Right. And a lot of these things are not like when we talk about cultural stigma, and a lot of time what we're talking about is race and ethnicity. And we're talking about the repercussions of colonization and oppression over centuries, right? And how that assimilation process has led into all these things like double consciousness. And again, won't go into all of that, but all of these concepts that basically talk about the ways that we are taught to hate ourselves and to not trust ourselves or things that are of our heritage, as Black people, Indigenous people, Latina people, Asian people, even people of European descent who don't go further back. And so when you learn those things, it challenges these stigmas. When we learn where stuff comes from, when we think about, okay, does it make sense? Where do my beliefs come from, right? Because we also have all had that experience where like we believed something, and then we learned better, right? And so validation of our ability to grow is really important. And the fact that we can change our beliefs, we can change, if we find out, if we get new information and we know something is wrong, right? Because we also don't want to validate things that are harming us. And so making sure that when you're challenging, just like coming out, right? It's not always safe to do that. And that doesn't mean you're making the wrong choice. That doesn't mean you're being less authentic. Your desire to stay alive is more important than your desire to shout, I'm gay or I'm trans, right? And that is a truth and that is authentic, right? And that's going to depend. And so knowing that internally helps us to combat stigma both internally and then externally when we're ready, right? Not everyone is always ready or always willing to take on that risk, right? And then also learning how to be okay with conflict is vital.
Yeah, thank you. I think that's a great note to end on. So we're going to open up the floor and start. I know the time just flew by, right? We're going to start having conversations where folks get to, ask some questions. So if you have any questions you'd like to ask our panelists, feel free to either put that in the chat over on YouTube or put that in the chat here. I have a couple colleagues in both spaces, so they will get that message to me. While you're thinking about writing stuff, I would love our wonderful panelists to throw their contact information in the chat here in Zoom as well, so we can have that information for future folks. If they're like, that was amazing, how can I learn more? How can I talk to this great person? Check out their practice, whatever it is. If you want to throw that in there while we're waiting for questions to come in. All right. Thank you both. Everybody's contact info is in the chat. I'm looking at our YouTube colleague, no questions from YouTube, but I do see a question in here. Awesome. So the question is, what would you say to someone who is scared or uncertain about seeking help?
Give yourself grace. It's totally normal. It is okay, because you are walking into like foreign territory. Never done this before. So you've never done it. This is the first time. So it's quite normal to be afraid. It's quite normal to maybe second guess. It's quite normal to just wonder, what are you getting yourself into? So step one is just to give yourself some grace. I would also say, like, kudos to you for being in a space to want to take that step. By all means, do it. You gotta start somewhere, but it takes a lot of courage to take that step. So totally normal to be in that space when you are in a realm of, like the unknown. You don't know what to expect. You don't know what's to come. You heard something, you read something, you don't know. Totally normal. So self-compassion and grace as you start your journey. Congratulations.
I would actually start with a question back, which is, what are you anxious about, or what are you afraid of? And then going from there, addressing that.
I know for me, if something I would say to someone who's uncertain about seeking for help, it's, going back to what is that fear? Like, what is, like Cassie mentioned, what is it that makes you anxious or makes you scared? But also giving yourself like grace, and reminding yourself, it's never too late. When you're ready, you're ready. I always applaud when a client comes in and they're like, this is my first time seeking therapy. It's great. It's not late, or it's not a bad thing that just because you're a specific age, or just because you're at a point where not a lot of people at that age are seeking mental health, that's nothing that's wrong. I always say, that's, like I mentioned before, it's not a sign of weakness, it's a sign of strength.
Awesome, thank you. Another question that somebody submitted is, how do you tell a therapist that they don't feel like the right fit, and how do you find someone new? I feel like this is a question we get a lot, and I love that someone asked it. So whoever wants to start.
Yeah, I'll start with that one. Tell them, like, again, this is why I said, like, conflict, specifically generative conflict, right? That thing where we're so focused on like being nice and like people liking us. Like, nah, fam, like, it's okay. Not everyone is going to be a good fit. I do a specific kind of therapy. I have specific types of training. People who want a therapist who is going to do short-term solution-based like CBT, don't come to me. It's a bad fit. And if you come into therapy and you're like, I'm not really sure, and we have a couple of sessions and you're like, yeah, you're weird and I don't know if I like you, I'm going to say, thank you for letting me know. And generally speaking, many therapists will then help to provide you some referrals, help to give you language around like what it is you might be looking for or might work better for you, right? And that can be anything, that could be anything from a different time. If the only time I have is during the day, and coming in during your lunch break doesn't work because you're afraid to like have cried and someone noticed, like, yeah, that's not going to be effective therapy, and it's okay. And so, like, another question in the chat, I'm just going to answer it with this because it's related, was with so many options for therapy available, it can be overwhelming with pressure to choose the right one. Any thoughts? Same thing. You don't have to choose the right one. It's an arduous process, and it sucks that there is a shortage of providers, especially providers who are Black, Latina, Asian, disabled, neurodivergent, what have you, right? Queer. However, again, challenge the perfectionism. It doesn't have to be the right one. that you start is a starting place, because once you do it once, guess what? You can do it again. You have proof of concept.
And I create a space. I always say that up front when I first start working with a client, like it's that first session where we do the intake and the assessment, all of that stuff. I make it clear, I'm going to check in with you from time to time. If this is not a good fit, you need to tell me. This is not about my feelings. It's not about making me feel good, because this really isn't about me. This is about you, the client, getting what it is that you need. You came through the door with something. There's specific work that you want to do, and it has to be a good fit. If you are going to sit with me in this space 1 hour a week, that is going to be terrible if you're in this space and it's like, okay, I hate this woman. I don't like her. And I've got to sit here every week. Oh, and possibly pay a copay. That is tragic. And I would not want that. So I would be doing a disservice by putting you in a space to feel obligated to stay with me if it's not working. And so I love to create a space where, one can say that. On the flip side, as a clinician, I know my limitations, and I know, where I am, my area of genius. I know that. And I am very transparent with clients about that. And as was stated earlier, if a client is coming through the door with something, it's like, okay, that's not in my realm. I will help you to connect to that next space. So working with me is never a dynamic where it's okay, good luck with life. This wasn't a good fit. Good luck. You'll figure it out the next time. I'm going to help you. In terms of what is out there now with these, these tech companies, that's one of the advertisements that a lot of them have. It's you don't like your therapist, you could switch at any time. So it just looks like it's this dynamic where it's okay, you know what, had this bad session on Monday, yep, don't like the therapist, okay, yep, I'm done with that, let me just try another one. And you're kind of going through the motions and you're switching therapists every day because they make it look that easy. But it's a no. There is something to be said about being able to have that honest conversation about what it is that you're needing. So that conflict and being able to sit in that space and have that dialogue with the clinician, because as was stated earlier, it could possibly be fixed. Maybe we change our time. Maybe we change the day. Maybe we do something in the evening. It could be that simple, but start with a conversation. It's okay.
100%. I always tell this to my clients too. When we have our intake session, I'm like, listen, this is what I do in therapy. These are some of the things I work with, like CBT. That's one of my go-tos. Like, this is the CBT I do. This is person-centered. This is what I do. Is this something that fits with you? Yes or no? Or what do you think of it? And I allow them to have that autonomy to be like, yes, I want to give it a go, or you know what, let me think about it. And that's the first step that I always say, like, great, like I'm letting you, as I mentioned, I'm letting you be the driver in the car. You tell me what you need. And then also, I always give it a month. I say, you know what, if we're going to work together, that's great. Let's give it a month. I always like to check in every month. How are you feeling in this therapy client relationship? Is there anything that you've noticed that you're like, I am not enjoying this, or this is something I enjoy? And if they go like, you know what, Abby, you're great, but I'm not feeling it. I never am like, oh, great. Like, well, I don't like you either. It's good to know you. Bye-bye. No, I'm always like, you know what? Thank you for sharing that. And I applaud them, because I'm like, did you notice that you just use your own autonomy and just told me, you know what? I don't want to work with you anymore. I want to work with someone else. And I always validate that. I'm like, thank you for sharing that. And again, I never leave them like alone. I'm not like, okay, if you don't like me, well, then have fun looking for your own therapist. I always ask them, well, what kind of therapist do you want? Or what are you looking for? Let me provide you with referrals. These are the referrals that I have. If anything else, if you need any else support before you go with your other therapist, like, let me know. I always just say, I'd rather you tell me as a therapist if you like the relationship of therapy and client than just maybe a year later being like, oh, I never liked you and I just came just cause.
Yeah, absolutely. And thank you so much. I know we have a couple other questions that didn't get answered, but I do want to mention that you have the contact info of all these incredible folks if you want to ask anyone specifically, because I do have to finish an outro so we can let all these wonderful people go back to their nights. So I am going to finish our conversation, but again, feel free to reach out to folks. Feel free to reach out to Hope for the Day as well if you'd like any of those questions answered as well, and we're happy to do that. All right, so unfortunately, we have to end this conversation. Those 40 minutes went by so fast, and I love that. So I want to say a huge thank you to everyone on this panel. It's been a great conversation, and I appreciate you sharing your expertise, your vulnerability, really answering the questions, and I love that. So if you're looking to learn more about anyone, like I said, all of their contact info is in the chat. Feel free to reach out. Feel free to check out what they're all about. And if you're looking for Hope for the Day, friendly reminder that we offer free education workshops at least once a month. And we also have a go at your own pace e-learning program if those times don't work for you and you want to check out what mental health is about, what suicide prevention is about. And you can also learn a lot more on hftv.org or register for any of those educations on peervention.org like you did today. So thank you so much for joining us. I really appreciate it. Have a great rest of your night, and I hope to see you all soon.